Special good morning to you, our viewers. Today, it's another installment episode of the Saint Lucia COVID-19 response report. Today is Wednesday, the 27th of May, a day after we saw the full culmination of the lower house sitting, in part to extend the state of emergency here in Saint Lucia to the 30th of September. My name is Jessie Leonce. If you're watching on air online, welcome to you as we go over the latest updates as it relates to COVID-19 in this country. I'm joined by my partner, Carlton Cyril. Good morning, Carlton.
Merci tellement, Jessie. Ça, c'est côté nous dit bien bonjour pour vous. Merci tellement à ce mercredi. Aujourd'hui, c'est le 27 mai. Headquarters COVID-19, qu'on l'a coutume nous avons tout développement information. L'année pour faire COVID. Nous avons dit un bel bonjour à ces gens qui sont sur Facebook. Pour ces gens qui sont l'autre pays, ces gens qui écoutent nous sur radio, nous avons dit bonjour à vous. Toujours un plaisir pour vous ici et puis nous avons support et écouter Gide information qui a sorti hard cette commande là. C'est un plaisir comme on dit merci et tellement et un bel bonjour à vous mercredi et bon matin.
We have a few updates for you this morning, among them the COVID-19 update testing of frontline workers coming from the Ministry of Health and Wellness, as well as St. Lucia receiving 26 negative test results. We also have that information coming from the Ministry of Health and Wellness. We will be hearing from the CMO, Dr. Sharon Belmar-George, shortly. Also, we have some clips, of the outstanding deliveries in yesterday's Parliamentary sitting of the lower house. We see the order paper, the papers that were laid, as well as the motions that were brought forward by the Minister of Finance yesterday. We do have these coming up, as well as an announcement from the Saint Lucia Solid Waste Management Authority. So that is coming up in just a moment. But first, we just want to give you some of the primary stats. We've had 18 cases of COVID-19 in Saint Lucia so far, and all 18 have fully recovered. At this time, we are enjoying a 100% recovery rate on island, and we've had no new cases. I think it's about 23 or 24 days so far, no new cases in that time span. However, we're not letting down our guard. We're not resting on our laurels, becoming complacent, as the Honorable Prime Minister stated yesterday in the Honorable House. We continue to be on alert. The threat of COVID-19 remains and continues, and if we're going to take the word of the international officials, the experts, they are saying that we're going to have to deal with COVID-19 for the next 2 years solidly, and others believe that we will just have to get used to COVID-19, it becoming endemic, to our global space. So we do have to keep our guard up at this time. Of course, we're still fresh from the onset of COVID-19. We're still trying to recover at this time. St. Lucia will be entering the fourth phase of its recovery in the first week of June, and that is when we will see the resumption of tourism accommodation services here on island. And so we do hope that as we try to keep our economy afloat and also observe the health protocols, the health measures that have been outlined by the authorities, we do so with the best conscience in mind. We do so keeping in mind all of the practices that we must take and must do in order to keep COVID-19 at bay.
Oui, en la coutume, nous avons et courant avec faire ça ça aller pour date nous ni 18 monde qui a recouvert les vini pour Covid, ça c'est 100%, nous pas ni personne qui a contacté maintenant, ça pas veut dire date qui il pas droit là, ça pas veut dire nous pas ni personne qui a joindre, mais pour date aujourd'hui c'est à peu près qui ça 23 jours, nous pas ni personne qui a contacté maintenant 100% tout le monde qui était hani a recouvert pour la peine nous a dit ça pas veut dire ou supposé double suivre protocole qu'on mettait massou wete kayou laver la main chaîne distance social là yon c'est bay lan qui plus important sou senti ou malade une pièce mal tête ben rien qui ka mouche signe de maladie la fièvre ou ka vomi est bien important pour aller yon dans ces cliniques là ni 5 cas sous pays ou ka savent Gozile Nyon polyclinique là ou ka l'hôpital Soufouya Saint Jude's et puis là ni l'hôpital d'Henry et puis là yo ka mando souple sou jamais quoi et bon senti yon manière ban l'autre pas ka senti bien aller souple faire asiwe ou aiwe et ben ou oti clinique là a parmi bagay ou kay savies de kay consit un chay bagay qui est TEC sorti là encore qu'on nous te hadou avec nous ka plus détaillé puis ça les vini pour gouvernement avec plan pour manière i kay manager affaire Covid là avec pays en chay bagay vini clarté qui discussion parlement c'est yon qui était bien intéressant qu'on a wete puis nous parmi l'autre bagay nous kay ba toutes ces informations ça avec développement toujours un plaisir pour nous et puis nous ici.
Just to let you know, if you're just joining us, good morning to you. We are back live from the Information Command Center at the GIS studios. As scheduled, we had scheduled for Wednesday more parliamentary proceedings. It would have been the continuation of the lower house sitting. However, the lower house sitting concluded at, I believe, 1 a.m. this morning. And so at this point, we will not be coming to you live from the Parliament today. Just to let you know, we are live from the Information Command Center this morning. We are on schedule for the resumption of parliamentary sitting, and that will be a sitting of the Senate, the upper house, and that will be tomorrow, Thursday, from 10 a.m. So we do hope you can tune in for that delivery as well. We are due for a break. When we come back, we go through the latest updates and yesterday's parliamentary proceedings. Stay tuned.
Better yet, use soap and water.
We must protect each other if we are to beat this corona.
Together let us win this war. Be a soldier for Saint Lucia. Together let us win this war. Be a soldier, together we can beat this corona.
So you don't become the next case. Avoid touching your face. I'm sure you've been told so. Handshakes and hugging are a no.
Advice is you the please. Cover your mouth and your nose if you cough or sneeze.
Practice social distancing and avoid large social gatherings.
Together let us win this war. Be a soldier for Saint Lucia. Together let us win this war. Saint Lucia, be a soldier. Together we can beat this corona.
For further information, please contact the hotline at 311 or the Bureau of Health Education at 468-5349.
Thank you so very much for staying tuned. If you're just joining us, this is the Saint Lucia COVID-19 response report for this morning as usual. My name is Jessie Leonce. I'm joined in studio by my colleague Carlton Cyril, and we continue with the important updates as it relates to COVID-19. At the top of this week, we heard from the Chief Medical Officer, Dr. Sharon Belmar-George from the Ministry of Health and Wellness, giving us an update on the testing of frontline workers. And if I'm just going to read an excerpt from this first press release for the week, Saint Lucia has carried out a total of 898 tests to date. Testing has been sustained throughout our response to the epidemic, although for the last week we noted reduced numbers of persons accessing care at the respiratory clinics, resulting in a reduced volume of persons being tested. This may be attributable to the fact that we are not in the flu season and there are reduced numbers of persons with respiratory signs and symptoms. We have intensified the testing of frontline workers from Sunday, May 24th, 2020, with priority of the health officers at the respiratory hospital, community respiratory clinics, and the fire service officers. And this testing will continue during the next few weeks. So we're getting the assurance from the CMO, of course, a critical sector at this time, our frontline workers coming into direct contact with persons who are potentially positive for COVID-19 being tested and on a regular basis to ensure that we do not have a transmission through our permeating through our first line of defense, being our frontline workers.
Et puis, merci tellement, Jesse. Quand il pour faire quoi pour sortir hot 6 mois, car dit pour date nous a testé à peu près presque 900 moun, 800 quelque moun a trouvé quoi yo testé les fini pour affaire Covid, mais yon a ces bagages là observé c'est date qui li mois plus bas, ça c'est moun qui a vini pour test là plus bas, mais il a dit ça peut-être c'est quand saison flou non saison flou qui a quitté nous peut-être c'est pour raison ça, mais qui a encouragé moun toujours sous ka mouche pièce sin les vini pour maladie Covid là ou supposé à test. Yon a ces bagages là qui bien important si moi mentionner, c'est les vini pour c'est travailler essentiel là. À présent il dit activité yo mettez attention yo et ka mais toute attention excusez-moi à sous ces moun ça quand c'est moun qu'on notre docteur c'est moun qui directement involvé traiter moun qui est ni vermine Covid là à présent si moi a dit yo ka bay ces moun ça priorité yo ka fait assurer ces moun ça yo trouver quoi yo tester ou ka bien d'accord ça c'est moun qui est directement involvé les vini pour combattre vermine Covid quand c'est une bonne nouvelle yon manière ben l'autre n'importe ça nous ça fait pour faire assurer nous wa bataille vermine parce que il a toujours la poko nan guérison pour lui quoi ou supposé ça depuis nous aller ligne ça c'est un bon bagage tout bonnement là il pour faire test by Covid.
Okay. The CMO further reiterated the need for our continued vigilance at this time. Individuals are getting the impression that perhaps we're seeing the borders being reopened and tourism, the resumption of tourism accommodation services on islands. So everything is going back to normal, and perhaps there is no need for some of the measures and some of the measures that have been implemented by government to continue. And I speak specifically to the state of emergency. We had some persons who were wondering, okay, well, why the extension of the state of emergency if we're reopening our country, if we're resuming our economy? We'll be hearing from the Honorable Prime Minister in terms of clips from parliamentary proceedings yesterday, explaining why it continues to be necessary that we have the state of emergency to continue until the 30th of September in the least. The CMO, until we get to that, the CMOs did continue to call upon individuals at the community level to continue to adopt the measures that have been put out, the protocols that have been put out by the Ministry of Health and Wellness, the government of Saint Lucia, to ensure that our community is safe and there is not community spread, at that level of COVID-19. She's calling on all community leaders, the gatekeepers, again, the heads of organizations within the community to support the Ministry of Health in the implementation of these measures. I mean, we've said the measures so many times, I don't even know if we go into, but for the sake of those who perhaps haven't, regular hand washing with soap and water or alcohol-based hand sanitizer where soap and water is not available, covering your mouth and nose with a disposable tissue or clothing when coughing or sneezing, avoiding close contact with anyone showing symptoms of respiratory illness such as coughing and sneezing. Wear your homemade mask or cloth mask whenever venturing out from your home. And you might think, you need to wear your mask to come to town, to take a bus and come to town, because I guess there is increased monitoring and surveillance in these areas. But we remind you that you need to wear your mask if you're simply going to the bakery in your community or you're going to the corner shop. It is important to wear your mask. And in turn, we encourage the individuals who run businesses in the communities to not allow community members to enter your place of business if they do not have a mask. Seeking medical attention if you have any symptoms suggestive of respiratory illness, and either during travel or after. Refraining from touching items unless you intend to buy them when grocery shopping. Maintaining a 6-foot distance. Maintaining a 6-foot distance. You know, some people perhaps may get offended because, you know, you step away from them. You give a 6-foot distance, but it is not to offend. I know we are very sociable, very warm, very loving people. St. Lucians are known for their hospitality, you know, and very warm demeanor and engagement. But at this time, we need to have a 6-foot distance in order, part of the effort to stave off COVID-19.
And I think it falls on good grounds, Jesse, when we speak of community leaders, and we very well heard the CMO asking to assist in that regards, and we heard it even in the interim of all what was happening as it relates to our pastors, our priests among us, persons, you know, activists in persons, the mothers and fathers group. You heard a cry goes out, and it is like assist persons in seeing the importance of the protocol, the national protocol. Et puis, nous avons parlé du protocole encore autant chef médical officier Saint Lucia, Dr. Belma George, qui a demandé, souple, c'est mon qui est en tête en chaille à ces organisations et associations en commune. Il a demandé prêtre, pasteur, Jean-Willision, Jean-Club, Mothers and Fathers, ces groupes ça pour prendre un pied devant et assister ka di moun assister pour faire assurer moun suivre protocole. Protocole là nous ka dit ici à constant. Ou ka ten nous ka dit ici qu'on nous toujours dit ici à c'est headquarters COVID-19 et puis yon manière ben l'autre nous ka fait devoir nous pour faire moun changer qui ça protocole là est. Masque là, l'on a quitté caillou en public ou supposé ni un masque. Et puis pour la peine, sous calan de pièce place business ou quoi ils savent, y en a ces conditions, c'est date qui ou obligé mettre un masque en parmi l'autre bagaille sanitize le monde. Quoi souple, mettez masque là. Sous pas ni pour quitter caillou, pas quitter caillou, ou était homo. Sous quitter caillou, ou doit aller en commune, ou doit aller en ville, n'importe quoi où aller, faire assurer ou chain distance social là. Qui ça y est, 6 pieds. Sous pas fin assurer, c'est des bras la main. Nous ka dit ça constant. Adele là dit moun ça, yo ka trouvé qu'on yo enfonce, accordé enfoncé, là dit un moun chain distance sous. Mais et tout, mais c'est un protocole national là. Là, il vient pour qu'à laver la main avec savon, là, ou sorti, sous entrant dans place business, marchandise là, sous pas vle gain, pas main, encore 20 000 à sous bagaille, ou pas jamais ça avec qu'on nous dit, il pas écrit en les fidjaï personne. Quoi, nous continuer ensemble, et puis 6 mois, qu'a fait moun savent, nous poko de combattre 20 000 corona. Il doit avoir là toujours tout ça ou peut faire. Et il y en a ces bagages là qui est bien important changer. Il a commencé et puis si vous prenez action, si vous décidez pour dire moi kay suivre protocole, ça veut dire qu'on protéger corps et qu'on protéger l'autre monde. Toujours conseil là Gide là nous ka ba ici ou était en écoute nous ka continuer ba information et développement à bon matin.
And following that first press release that we received from the Ministry of Health and Wellness this week, we got a following one on the 26th of May. St. Lucia receives 26 negative test results. And if you could just go to the clip of Dr. Sharon Belmar George just giving the outcome of those tests and stating the number of tests that have been conducted in St. Lucia so far. I know we're nearing the 1,000 mark.
Test results received on Tuesday, May 26, 2020 for 26 samples are all negative. St. Lucia has carried out a total of 924 tests conducted to date. This week, we continue testing at the community level and our frontline workers. As we prepare for the phased opening of the increasing sectors, we continue to guide the public on measures to reduce the transmission of COVID-19. We continue to request that every individual practices the standard recommendations to prevent the spread of infection.
And the CMO is stressing on the measures once again at this time. Well, just to let you know, 924 cases have since been conducted to date, and a total of 18 confirmed cases all recovered. Test results received on Tuesday, that was yesterday, May 26th, all came back negative. So we continue to get a recording of negative test results, and we are very pleased with that. It means that the ongoing efforts, the initial efforts and ongoing efforts in terms of our response to COVID-19 here in Saint Lucia has been very effective.
Rightly so, Jesse, to see 924 tests, 924 tests nous avons fait pour date, et puis là, CMO a dit, dernier set là, yo hen 26 set ça, nous avons date qui toute vie négative, quoi, action, et puis, ça CMO et puis office li ka fait les vini pour ka tester moun ka mande moun pour entrer nous ka ouais déjà c'est un bon bagay parce que plus test ni il ka ba ou éducation à pour côté ouye et puis moun qui paie ni événement quoi c'est un bon signe tout bonnement avec bonne nouvelle vous savez nous a presque 1000 ka tester moun nous savent il bien important les vini pour test là quoi bonne nouvelle pour date encore nous avons information cette lycée a avoué 924 tests et vous avez changé encore nous te dit nous commencer 18 moun a recouvert quoi pour date nous pas ni personne qui a contacté Vermina mais ça pas veut dire ou pas supposé suivre protocole nous a plaidé pour encore continuer suivre protocole qui a établi.
Yeah, it becomes all the more imperative as we open, we have the phased opening of our economy to observe all of the protocols that we spoke about earlier, and we will be having visitors coming to the island. We need to ensure that we take a personal responsibility, for our homes as well, in terms of keeping COVID-19 at bay. Washing of the hands, wearing the mask when you go out, 6 foot distance. We cannot begin to stress it enough. It is very important, and it is what has kept us. Studies have shown that individuals who just wear simply a mask reduces the risk of infection in a particular state, in a particular community, a capital, a city. And so we hope that you keep these things in mind as you go about your business. Sometimes, I mean, yesterday I met a family member in Castries, and I had to be very careful. You know, the knee jerk is to hug and kiss, but we need to be very careful when we go out. And please remember, and I believe Naomi Grandison from the Bureau of Health, she did state that we need to begin to even practice it at home.
Yeah.
You know, just wearing a mask at home so that it becomes second nature, because you're running out of your car to go into a store or run to the supermarket, and you're not even thinking, grab my mask. We need to begin to practice, grab the mask, put it on, go. Grab the mask, wash your hands, you know, 6 foot distance. We need to make it habit because, of course, it will be the new normal.
And just to add to that, Jesse, one of the things that's really important, I think all of us could attest to the fact that you go around and you see people or you see persons gathering together, and it's all well to gather together. Persons have been inside for so long. The distance, the social distancing. I mean, if we could come together, there's nothing wrong in keeping the distance. The mask, some people will tell you they cannot breathe through the mask. But just imagine you not having a mask and you're that close. Again, the responsibility falls on you. Là, vini pour ou ka suivre protocole nous ka dit ou ka passer ou ka kon place la ka vie ouvert, c'est comme si tout le monde ka dou panique am Covid encore. C'est comme si garçon ouais moi ça prend les fidjay moi panique. Ouais moi ça moun qui ni corona, il prend les fidjay personne tout ça il pour point c'est yon moun avec bonne nouvelle à présent. Avec zone nan ouvert à présent tout ça il pour point c'est yon moun qui sorti en sud là vinn en nord là passer soleil couchant avec là nous ka vie ouais qui ça fait mais c'est sous ça protecter corps chain distance là mettez masque là nous tout ni pour observer protocole mais moi même ka dit responsabilité à tomber à sous ça pas veut dire qu'on place là ouvert nous pas ni corona ça nous ka dit c'est il pas ka ti rien là pour suivre guide pour suivre protocole mettez masque laver la main chain distance là ou était caillou avec sous santé ou malade aller couiller free 11 là ni moi pour couiller avant aller et ben aller en clinique là nous ca continuellement dit ça ici.
Do stay tuned. When we come back, we get into yesterday's parliamentary proceedings, the sitting of the lower house, the House of Representatives, to discuss, among other things, the motion being forwarded, the motion that was forwarded to extend the state of emergency. We want you to stay tuned. We'll be right back after this break.
Saint Lucia ka registré vers min corona et ka fait mouvement et quand chaque vitesse tan chaque canef ka couiller pour vigilance publique là fait wolo parler en place publique qu'on bol en main base ti boutique changer distance sociale 6 pieds Rodyon à l'autre. Et quand tu travailles, si vous sentez qu'on pas cordial, quarantine qu'on pas en contact et puis l'autre, en cas où tu es exposé. C'est un écuyer, free 11 ou bien n'importe clinique qui est pour les pays à 10 000 à clé, ça veut dire les supermarkets, pharmacies et puis ATM, yo accessible avant c'était souhait. Pays à clé en plein, ça veut dire tout bagay fermé à 24 heures. Servi protocole comme sorti par bureau indication santé. Nous tout ensemble, ça sauver vers min corona. Si nous tous servi jidla à toutes les.
Together let us win this war. Saint Lucia be a soldier. Together we can beat this corona.
Thank you so much for staying tuned. If you're just joining us, a special welcome to you. We are live from the Government Information Studio, from the Information Command Center with this morning's COVID-19 response report. I just saw a query, somebody asking about the channel that we're on cable. It is 122 on cable television, NTN. We continue with this morning's response report with yesterday's parliamentary proceedings. We had the sitting of the House of Assembly, and apart from the papers to be laid, we had the motions being forwarded to extend for an additional period commencing on the 1st day of June to the 30th of September the state of emergency that is in Saint Lucia. The state of emergency, the initial extension that we got, because there was a first extension, it was toward the 31st of May, and that would have expired on that day. The state of emergency would have expired on that day had the government of Saint Lucia not returned to the Honorable House to propose to put forward an extension. So that extension was forwarded, as well as a motion also to authorize the Minister of Finance to borrow by means of advances sums not exceeding $85 million from commercial banks for a period of 6 months from the date hereof, which sums shall be charged on and paid out to the consolidated fund. And finally, the last motion, Parliament authorizing the Minister for Finance to borrow the sum of US $29 million by way of rapid credit facility loan from the International Monetary Fund for the purpose of capital and recurrent expenditure. The loan is repayable at a 0% interest rate, inclusive of a 5.5 years grace period with a final maturity of 10 years and semi-annually through a standing authorization to the International Monetary Fund to debit St. Lucia's XDR account with the amount of all financial obligations to the International Monetary Fund for the Rapid Credit Facility loan as the financial obligations fall due. So that formed the debate yesterday.
Et puis, oui, Saint Lucia, qu'on a bien savent, là, il vient pour Premier ministre, puis cabinet, là, Parlement, là, en caille concite, il joint hier. Et puis, parmi motions, il présenté, au caille, premier pas, au caille, la Premier ministre, comme ministre des Finances, t'es qu'à demander pour ajouter état de secours. Bon, on bien savait, état de secours, ça a supposé bout, venir bout, moi, ça, qui c'est les 31, il était 31 mai, il était supposé venir en bout 31 mai. Quoi, il vient demander pour ajouter, quand il a commencé le 1er juin, avec bout 30 septembre, qui avait, ça a 4 mois, il vient demander pour ajouter. Parmi l'autre bagaille aussi, ou kay une motion côté Premier ministre encore, comme ministre des Finances, vini demander Parlement pour l'ini permission pour s'apprêter l'argent, pas plus passer 85 millions de dollars. 85 millions de dollars. Si nous avons en débat hier, ou nous avons le Premier ministre dit avant, ça c'était 55 millions de dollars, ministre des Finances t'a prêté. Quand il vient pour une permission pour prêter plus passer 55 ans, qui c'est 85 millions dollars. Après ça, nous aussi, côté Premier ministre, demandé permission. Là, il vient pour lui, comme ministre des Finances encore, pour prêter 29 millions de dollars US. IMF là, en bas fond yo kouye rapid credit, en bas faciliter ça IMF. Bon, la ni condition là vini pour lui, l'on yo ni pour VIP et l'on ça, et quand parmi l'autre bagaille, il ka demandé autorisation date qui là vini pour IMF là, l'argent ça nous kay wey qu'on faciliter crédit. Ça, c'est obligation, comme on dit encore, Saint Lucia ni pour faire assurer, yo payer dette ça, et puis yo ka ni 0% l'intérêt à souy, et puis ça kay aussi pour 5 l'année et demi en goisse. Yo kay ba yo goisse pour 5 l'année et demi, et puis là nous kay il ka matuité l'on ça kay matuité en 10 ans. En 10 ans. Et puis, il y a une autorisation IMF là pour mettre l'argent ça qu'on y a facilité. Encore Premier ministre vini devant Kailan pour 3 ces motions ça. Et puis, parmi l'autre bagaille, nous yo parlé de CIP, ça pour venir. Mais hier encore, en Kai Concite, c'était raison, Premier ministre, comme ministre des Finances, vini adresser Kai Parlement.
In his statement on the motion to Parliament to extend the state of emergency yesterday, the Honorable Prime Minister and Minister for Finance, Economic Growth, Job Creation, External Affairs and the Public Service, a mouthful, the Honorable Alan Chasney, he did provide a status report of all the efforts of government up to that point so far in terms of its response to COVID-19. And we're talking about the National Health Security Committee being activated. That was January 31st. So our efforts to contain and to manage COVID-19 have gone as far back as the 31st of January. In February, the activation of the National Emergency Management Advisory Committee, that's NEMAC. And March 16th, we saw the 311 call center activated to receive calls on COVID-19. March 18th, the establishment of the Command Center for Operations and the setup of the Information Headquarters at GIS right here for factual information dissemination. March 20th, the processing for the quarantine facilities had begun. March 23rd, the first declaration of the state of emergency by the Governor General, and the following day, Parliament approved the extension of the state of emergency for a further period of 26 days. At the same time, Parliament approved the Emergency Powers Disasters COVID Order. And this allowed the competent authority to implement protective measures such as the closure of borders, the cancellation of all mass crowd events, and a curfew from 11 to 5 a.m. March 23rd, we saw the commencement of testing for COVID-19 here on island. Prior to that, we were sending our samples to CARFA. And so on March 23rd, we were able to now test in Saint Lucia at the Ezra Long Laboratory. March 26th, we welcomed the 113 Cuban medical professionals. They arrived in St. Lucia to assist with our response to COVID-19. March 27th, we transitioned fully to the OKEU hospital and designated the Victoria Hospital as a respiratory center. April 1st, a 24-hour curfew was implemented and NEMO began immediate mobilization for the distribution of care packages. We also saw on the 29th of April, government announcing its social stabilization plan. And laced in between those announcements, those developments, were various adjustments and responses to cases as they came up or other developments as they would have come up. So you would have seen announcements from the CMO, decisions to withhold alcohol. We saw the alcohol, the liquor license suspension. We saw the curfew order. All of these things outlined within the curfew order. We saw that coming and going based on the scientific data that we were getting from the Ministry of Health and Wellness and them from ultimately the World Health Organization. The Honorable Prime Minister spoke to the necessity of all of these steps that were taken, and he stated that we should not become complacent and that we cannot afford to drop our guard or return to our previous way of life. Things will change, as we have been stating here so far this morning. And he did add that we can no longer exist in a bubble. The whole idea of the trade-off between our economic development and our adherence to the health and safety measures. But he stated we can no longer continue to exist in a bubble. Safety, hygiene, and economic stability will be even more important in designing the post-lockdown world. I just want to go to the first clip we have of the Honorable Prime Minister. We did have the parliamentary opposition in the initial stages, expressing their concern naturally for the abuse of power of this state of emergency. However, the Honorable Prime Minister has articulated and explained the rationale for the extension of the state of emergency in these few clips.
Mr. Speaker, the all clear has not been given. Our strategy has now shifted, and in the words of our Chief Medical Officer, Dr. Sharon Belmar-George, and I quote, "Although at this point we have flattened our curve, as we lift the public health and social measures that were implemented to contain and reduce transmission, we anticipate the resurgence of cases with the opening of the borders, as most countries remain in active infection. Also, our population remains susceptible to COVID-19, so the risk of transmission once introduction occurs is likely. Our CMO further advises that based on the new current evidence, it is envisaged that we progress and move from one phase to another. We will experience, it is envisioned that as we move and progress from one phase to another, we will experience recurring epidemic waves with continuous low-level transmission. Therefore, our efforts must ensure we maintain the waves as low and manageable as possible so as not to overwhelm our healthcare system. The CMO went further to advise this would require an efficient system to ensure the rapid implementation of measures which the state of emergency allows. This includes the curfew, the use of zones if necessary, or any scale-back measures. Governments across the region are working to balance public health protection with the need to protect jobs and our economies. To this end, Saint Lucia has adopted a phased approach to a new normal. Much of it is fluid and requires quick and sound decisions. It is evident that much of the progress we have made thus far was effectively achieved through a state of emergency.
That was the Honorable Prime Minister Alan Chasney speaking at yesterday's sitting of the House of Assembly. That's just a clip there from his statement on the motion to Parliament to extend the state of emergency, articulating in that last clip the government's heavy reliance on the scientific data, relying on the CMO's word on how we proceed, what provisions, what permissions, how can we go forward. And of course, we have seen, even with the framework to reopen St. Lucia's society, we had the assessment coming from the command center. It has been on replay on NTN, if you've been looking out for it, if you've been listening to it. We've been hearing from the individuals at the helm, at the command center of our response to COVID-19, their heavy reliance on the data. the data, and relying on the World Health Organization's framework, so to speak, templates, so to speak. Should this occur, what you should do. Should this occur, what you should do. And it is what has guided our framework for not only mitigation efforts, but also our recovery at this time.
Rightly so, Jesse. Bien important, messieurs dames, encore sur ou ka coûter ou ka ver puis nous ka prendre détail ça qui fait hier en kai concite là venu pour premier ministre là ka fait ses motions et puis nous a sous raison ibaï là venu pour ka demander pour ajouter état de secours encore qu'on nous te dit a été supposé bout moi ça mais il a permission kai concite là pour faire assurer hygiène pour l'autre 4 mois qui a commencé le 1er juin bout 30 septembre quoi en parmi bagaille mentionné c'est qui manière toute bagaille commencer pour mener nous connauiller à présent là on savent commencer le 31 janvier ça c'est après organisation qui est responsable pour santé la WHO dit nous dans état de secours là venu pour affaire vermine Covid là et puis il dit qui ça qui fait là Saint Lucia le 31 au cas où un comité trouvé quoi établi ça c'est un comité national pour santé comité ça a été trouvé quoi activé après ça nous le 28 février l'autre comité qui a les non NIMAC nous NIMAC trouvé quoi établi et puis yo responsable là venu pour état nous des secours national management pour bail conseil comité ça supposé bail conseil bail NIMO et puis gouvernement après ça nous le 16 mars centre qui établi avec l'IMOA côté moun sa kriye l'IMOA 3 yon free 11 nous centre ça établi et ça c'est pour moun rien qui ni pour fête et puis Covid pour aller plus devant le 18 nous en centre commande trouvé quoi en opération et puis là ça c'est ici à comment headquarters Covid côté nous ka bay information avec développement là pour faire et puis Covid allez le 20 mars nous commencer c'est facilité à qui responsable pour quarantine yo commencé à processer le 23 nous teni première déclaration de état de Soukounou qui sorti gouverneur général là et puis Parlement te bay premier 26 juin et puis en même temps nous avons approuvé pouvoir là vini pour ces moun sa état de secours là vini pour COVID-19 et puis tout ça te ka fait ka mouche nous côté nous y pour un jour qu'on aujourd'hui mars le 23 mars nous commencer ka faire tester le 26 nous transition l'hôpital Victoria pour OKEU après l'autre bagaille le premier avril ça y nous en 24 nédican état de secours côté monter en baclé personne pas de ça sort de faire rien à part dire ces gens travailleurs essentiel et puis mener le 29 côté gouvernement annoncé plan pour stimuler l'économie et puis stabiliser après ça nous parmi l'autre bagaille côté nous hier à présent côté petit business qui ouvert côté yo bail permission quoi ça c'était raison gouvernement bail ça qui était bien important il dit en bout de présentation il dit lui-même et puis cabinet li pas qu'à faire rien sans yo un conseil hod CMOA avec office command centre qui est responsable pour Covid. Quoi ça c'était explanation et yon ces bagaille là nous kay bien vle di ici là venu pour opposition, yo était bien clair, là venu pour qualité pouvoir qualité motion ça ka bay premier ministre là yo ka di yo concerné di lui même ka abusé et puis yo ka di ça c'est conseil yo pour qui parmi l'autre bagaille yo mandé qui manière compter longtemps mais tout en tout c'est ça qui était point coup hier là où il venu pour première motion premier ministre.
And just to go back to the clip, the Honorable Prime Minister did state that according to the CMO, Dr. Sharon Belmar-George, that based on the current evidence, the data that we're receiving, it is envisaged that we progress from we progress and move from one phase to another, we will experience recurring epidemic waves with continuous low-level transmission. We have to be realistic here.
Yeah.
As we open our economy, which we must do, all other countries are looking to find a way to resume their economic activity as best as possible, especially during this time of crisis. There will be we have to be prepared for, realistically, increased cases of COVID-19 in the various jurisdictions, in the various territories. So I just want to go to a clip now of the Honorable Prime Minister explaining the need for the state of emergency based on this word from the CMO and the level of transparency that the government has had so far. And we've seen, even with the Information Command Center, also the level of frankness that we have gotten from the government of Saint Lucia. Even when it was not popular, the decision to suspend social gatherings and the liquor license and so on. We go to the clip now of the Honorable Prime Minister explaining the need for the SOE, the need to move expeditiously should we have to face, a situation that is, that requires a quick movement.
Mr. Speaker, the evidence for the necessity for a state of emergency is clear. This government has been responsible in our actions under the Emergency Powers Act. Every time we amend or adjust any part of the Act, every single time we put a new measure in place, we reported and informed the people of St. Lucia. We explained why every step of the way. The recordings, videos, and constant reporting is available for all to see. The simple fact is the state of emergency allows us to move swiftly between phases, especially as the virus itself evolves. This would not be possible under normal circumstances. We can plan and be prepared for COVID-19, but all of us who watch the international news will observe that this virus is ever-changing and we need to adapt accordingly. Therefore, our state of readiness today may be very different next week, depending on the effects of its impact.
That was the Honorable Prime Minister there, the last clip that we have of the Prime Minister speaking on the reason, the rationale, explaining the need for an extension of the state of emergency. If you're just joining us, a special good morning to you. We are discussing the latest developments surrounding our response to COVID-19 here in St. Lucia. And we're just coming off of the Prime Minister's explanation, talking about how the government of St. Lucia has taken the public, the population, every step of the way in terms of its response to COVID-19 and its need to, going forward, as we reopen our economy. We've begun doing so. We're in between phase 3 and phase 4. Officially, we go into phase 4 in the first week of June with the resumption of tourism accommodation services and the reopening of our borders. But even as we do that, we need to be prepared, if needs be, to take mitigative action if we have to revert to previous phases, if there are triggers. For example, if I can refer to the framework to reopen St. Lucia, as we going into phase 4, if there is a cluster of 30 cases, that would warrant us to trigger and revert, that would be a trigger reverting us back to a previous phase. Perhaps we might have to go under a longer curfew. More restrictions may have to come into play to ensure that we can protect the population at large. The Honorable Prime Minister has confidence in this 5-phase approach. He did state his confidence in the 5-phased approach to reopening our society. He states that the plan is simple, and if you listen to the framework to reopen St. Lucia society, it's clear-cut in what is being done as we advance to new stages, because we've come from phase 1, phase 2, phase 3, the mitigative process, the mitigative phases, into phase 4 as we begin to recover and try to resume some sort of normalcy, although not too normal, because we have certain things that we need to do that we've never done before, wearing of masks, 6-foot distance, etc. But the confidence, he expressed it in the 5-phased approach, and speaking about the foundation of this phased approach being the structured and methodical way that they're approaching the preservation of our physical and mental health, our safety, and our general well-being of the people through robust social, healthcare, security, and economic measures. He did reference an example from moving from one phase to another or reverting to a previous phase. It would depend on key identifiable triggers. as we've been going over, if you have seen the consultation that was held 2 Fridays back on the framework to reopen St. Lucia Society, it was clearly stated, clearly articulated what the triggers will be if we have to go back to a previous time when we were just being confronted with COVID-19. Should we have an increase in cases? Should we have to deal with increased individuals in quarantine? There are measures in place to deal with these number of contingencies.
And Jesse, rightly so, as it relates to what would cause us to go forward or backward. Nous ici à discuter, Premier ministre n'a pas besoin parmi l'autre bagaille pour qui ça était mérité pour ajouter à ce état de secours. Il y en a ces bagailles qui viennent dans l'idée, c'est consultation. Et qu'en consultation, ça, en chaque raison te bail pour qui ça nous aller devant et qui manière nous aller devant. Pas ça simplement, qui ça qui en cause nous vier derrière, parce que combien savent nous ka ouvert nous ka essayer allant dans position nous ka essayer vie normal qu'on nous bien savent normal là pas qu'on était avant, mais il y en a ces bagailles là qui bien important pour nous pe savent les vini pour ces décisions ça changer encore. Premier ministre fait bien clair, conseil qui a sorti hord sans commande là yo ensemble si mois kay bay directive ça gide qui manière nous ka aller devant en même voie yo ka servi 14 jours pour qui ça qui a fait yo ka verser limo et en laisse ça yo ka prendre décision. Mais ça qui est bien important, par exemple, nous t'étant en consultation date qui si nous entrer en phase 4, qui ça qui a vie mener nous en phase 3 avec explanation par exemple si nous tend en chaque côté en coin Saint Lucia nous dit en nord sud soleil couchant soleil levant nous tend l'anica à peu près 10 fois monde. Quoi là ça c'est en cause conseil là si moi qui dit ça qu'il y a une raison pour qui ça qui a fait si dans 14 jours ça en temps ça nous ka 10 monde trouver quoi yo affecté ça c'est un conseil pour nous ouais qui bagaille pas ka marcher manière supposé. Mais il y a un autre exemple, il dit si vous avez 10 monde dans yon ka yon famille ni trouver quoi yo contacter c'est moun ça ni vermine il ka dit c'est un bagay qui différent parce que tout ces moun ça dans yon ka quoi ouais décision pour aller devant décision pour ouvrir place là c'est pas une décision ni ka prend vai c'est yon yo ka veiller c'est limoa ka veiller ça qui fait dans 2 semaines pour faire assurer pas du temps nous ka aller devant nous pas ka mener vermine et puis nous faire bagay plus mauvais passé ici. Quand parmi bagay avec raison premier ministre bay c'était c'est raison ça qu'avait qui ça qui a une cause nous pour vier qui ça qu'a fait nous aille devant est bien important pour ça les vini pour parler de 4e phase là et 5e là il y en a ces bagay là qui bien important yo ka dit parmi l'autre bagay stimuler l'économie parmi bagay fait assurer nous ni résilience les vini pour département santé nous fait assurer les vini pour en chaque secteur dat qui bagay ja en place fait assurer yo vieux ouvert pour tourisme parmi bagay c'est ça yo quand temps me fait mais en même voie qui ça fait nous vier si nous 30 cas si c'est cas ça vini ça veut dire nous kay ni pour vier mettre bagay en place qui te ka chaîne nous qui te ka pêcher vermine transmitter quand c'est yon nous ka changer nous aller yon c'est bagay là qui bien clair c'est date qui personne pas ni yon réponse pour dire c'est ça hier.
Thanks for that, Carlton. And just to add to that, the Prime Minister, the Honourable Prime Minister, further stated that the state of emergency in St. Lucia, the application into Parliament for its extension, will also permit the continuation of the assistance that we're getting from Cuba. The Cuban medical team that is authorized to work in St. Lucia is only authorized to work on island only during the state of emergency. And if we continue to have them here on island, it will strengthen our personnel capacities within the health sector during this very volatile period. We have to be prepared for any eventuality. Should we have perhaps another outbreak of COVID-19 here on island, we would be very grateful to have the continued work and effort of the 130 13 Cuban medical team strong here on island. We are due for another break. When we come back, we get an update on the National Insurance Corporation figures so far. How many persons have benefited from the employment relief program, the income support that has been given to individuals who have lost their jobs due to the effects, the impact of COVID-19. Stay tuned.
And in the latest news, the coronavirus, or COVID-19, continues to be a health emergency across the world. Caribbean people are concerned.
Everybody know about COVID-19. COVID-19. Keep socially distant and your proper hygiene. Wash your hands then clean. And don't discriminate, cause it might be. It very well could be. Somebody will look like you or look like me. Listening, listening. We're in this together. We all got to work with each other. Look out for our friends and our neighbor. And if you feel sick, don't be afraid to call the doctor.
Red Cross volunteers from across the Caribbean, working hard to fight discrimination. So if a person should feel ill, then they will contact the authorities without hesitation.
The most vulnerable are the elderly, but the truth is it can infect anybody. So what we need is solidarity. Everyone helping everyone like a family. So
this is a message to the nation. Make sure you seek out the right information from official sources like the Ministry of Health, Red Cross and the World Health Organization.
Everybody know about COVID-19. COVID-19. Keep socially distant and your proper hygiene. Wash your hands then clean. Don't discriminate, cause it might be. It very well could be. Somebody will look like you or look like me. Listening, listening.
People around the world facing this pandemic. Coronavirus have the whole world a panic. Now is not the time to be fearful, but to be careful, supportive and empathetic.
This is the state of the society. Some people full of fear and anxiety. Yo, a lot of fake news in the community. But what we need now is more love and unity. So
this is a message to the nation. Make sure you seek out the right information from official sources like the Ministry of Health, Red Cross and the World Health Organization.
Everybody know about COVID-19. COVID-19. Keep socially distant and your proper hygiene. Wash your hands then clean. Don't discriminate, cause it might be. It very well could be. Somebody will look like you or look like me. Listening, listening. We're in this together. We all got to work with each other. Look out for our friends and our neighbor. And if you feel sick, don't be afraid to call the doctor.
Thank you so much for staying tuned. We're now wound down to our final segment for this morning's COVID-19 response report. Just want to go to a clip. Many persons have been wondering what's going on with the NIC. To what extent have they been able to assist the affected population so far in this economic relief program, income support for individuals who have lost their jobs due to the effect of COVID-19. Saint Lucia is heavily dependent. It is our lifeline on tourism, and we know that tourism was all but lost when globally there was a shutdown due to COVID-19. We hear from the Economic Development Minister, also the MP for Castries Southeast, giving us an update on how the National Insurance Corporation has been able to assist so far.
Presently, according to my information, the NIC total amount paid as of 23rd May 2020 is $5,396,063.40. That is under the assistance for unemployed people by the NIC. Mr. Speaker, the average payout per person is $935.36, and here's the breakdown. Total number of persons paid as of 23rd May 2020, 5,769 people. Applicants in receipt of relief of 1,000 and over, 2,573 people have received 1,000 or more than 1,000. 1,000 or over. Applicants in receipt of relief less than 1,000, 3,169. 45% of the persons paid have received over $1,000.
So hearing from the Economic Development Minister and the MP for Castries Southeast in his address yesterday, contribution to the debate yesterday in the Honorable House of Assembly, he did give us the update that as at 23rd May, according to the information he has received, I would imagine it's coming from the NIC, that approximately 5,769 individuals have so far benefited from the economic relief program of the NIC. And of that sum, over 1,000, over 2,000, that's about 2,573 individuals got more than $1,000 per month. So that's the figures there. That's more than 45% of the total number of individuals who got the sum of the income support from the NIC, getting more than $1,000. In total, 5,769 people have been assisted by received income support from the NIC to date. So please take note of that. If you have so far been experiencing any difficulties in being able to access the income support from the NIC, and you are one of the individuals who've been affected, you've lost your job due to COVID-19, I do advise you to contact the NIC as soon as possible. There are several factors at play. They're waiting on your employer to fill out the information that is needed to give the necessary data that they need in the employer portal. And you also need to take initiative to ensure that you provide them with all of the information that they need from you so that the payout to you can be made as soon as possible.
Merci tellement, Jesse. Qu'on nous a dit merci pour vous qui écoutez, continuez à écouter puis nous soit mercredi bon matin nous allons continuer ba ou information qu'on est pour faire COVID ici c'est headquarters COVID là moi studio ici et puis Jesse Léon c'est non c'est Carlton Cyril là hier ou kaitan parler de NIC et contribution c'est yon c'est bail qui est mentionné en kai consiste que nous monsieur honorable Guy Joseph qui a information pour date là pour faire NIC il y a à peu près 5 millions de dollars j'ai trouvé quoi y payer 5 millions de dollars j'ai trouvé quoi y payer parmi ça il dit en tout 5769 moun trouve une assistance pour date ça c'est pour date et puis plus passé il a dit 75% en ces moun ça joine plus passer $1,000 et l'année à peu près 2,000 moun qui hen plus passer ça quoi en information qui a sorti hod nous tan hod monsieur honorable Guy Joseph Laini pour faire PNIC pour date $5 millions a trouvé quoi dépenser là ben moun a hen assistance hod NIC ça c'est moun qui ja hen assistance dans ba programme nan Laini pour faire moun qui trouvé quoi yo affecté par Covid et puis plus passé à peu près 5,769 moun trouvé support déjà. Encore qu'a changé nous te parler by monsieur McNaughton qui ici a été fait qui dit parmi bagay ici personne ni pièce problème ou peut couiller li moi 457 6003 457-6003 et ben juste dit où ça aller sur internet là COVID-19 at stlucianic.org. Ça c'est sur ni pièce problème. Maintenant c'est bail là il fait bien clair à délai problème là c'est côté au travail là pour couvrir information ba yo et ben l'autre bagay là c'est yo même poko receiver ben ou même poko fini application quoi il tombe les bons oreilles qu'on nous bien d'où nous ba information qu'on nous ni ici à headquarters COVID. Merci tellement.
Again, the number to call if you're experiencing any difficulties in accessing the income support as provided by the NIC under the Economic Relief Program. You can call the number 457-6003. And we're still getting complaints of persons only receiving $16. I think that was more than clarified by the communications consultant at the NIC, Mr. McNaughton McLean. He indicated that if you would have received a stipend from your employer, then the balance of that, if you were to receive in a minimum of $500, the balance would be paid to you by the NIC. So if your employer gave you $460 and you were entitled to $500, the NIC would pay you $40. So that is the way it has been put together in terms of the economic relief program, and that was documented from the beginning of the economic relief program. Right. So we encourage you to stay on top of things by reading all of the information that we put out on the Government of Saint Lucia website, on the Government of Saint Lucia Facebook page, YouTube channel. Please stay abreast of everything as it happens, so that as the rollout of these initiatives to help us recover from COVID-19 are rolled out, we don't get individuals who are confused or not sure of what's happening. So in order for you to keep abreast, you can stay tuned to the Government of Saint Lucia websites, Facebook page, all our social media platforms, as well as the NIC in this regard, in this respect, the NIC Facebook page as well. So again, thank you to Mr. McNaughton McLean for bringing some clarification on what seemed initially as very very scary and worrying, and anxiety-filled deposits being made on people's bank accounts. But we got the clarification that if you got a stipend of any sort from your employer, as I said, if you got $460 from your employer in terms of a stipend after being laid off, then the NIC, if you were due $500, the NIC would pay your balance, which would be, of course, $40.
And of course, Jesse, that goes on without saying that if you receive that payment, it would automatically mean a payment or deduction would have gone to NIC, which was one of the reasons why Mr. McNaughton said it's deductible from whatever that was paid by your employer. And I think that is where we had the ticklish, or we had the little misunderstanding. Qui c'est, yon nan se bagay la nou vle fè bien clair ek nou tan ni hot Mr. McNaughton McLean qui ka pale le vini pour communication la by NIC. Il dit si côté place là ou ka travail là, si yo paye en fortnight, si yo paye en semaine, si yo ba ou pièce paiement, l'argent est supposé hen hot NIC, yo ka tirer l'argent ça à souille. Qu'on a trouvé qu'on informé, ça c'est yon ces raisons, ça qu'a fait bien important dat ki moun savent ça.
Thanks for that, Carlton. And with that, we wrap up today's COVID-19 response report. It has been a pleasure again informing you, keeping you abreast of everything that is happening, including yesterday's parliamentary proceedings of the sitting of the lower house, the House of Representatives, among other things, debating the motion put forward to extend the state of emergency in Saint Lucia. Tomorrow, parliamentary proceedings continue with a sitting of the upper house, that is the Senate, and they will be continuing the debates with the motions that have been forwarded from yesterday. Do stay tuned to NTN for any further programming with regard to COVID-19 and general Government of Saint Lucia updates. I thank you so much for watching. On behalf of Carlton and Cyril and our production team as well, much thanks to them for keeping us on the up and up as it pertains to our production. Vibert Ramo as well as Roger Varro Lawrence, we'd like to thank them. But on behalf of them, we'd like to thank you so much for tuning in, watching, getting updated, and trying to weather this storm of COVID-19. My name is Jessie Leonce. Goodbye for now. Stay tuned for more NTN programming.